Hi, I am Dr. Rajas Deshpande, Director of Neurology at Ruby Hall Clinic, Pune, India. I will speak about epilepsy for my patients today. Our brain functions based upon electrical activity. Sometimes the brain cells or neurons generate abnormal excessive electrical activity which may stay restricted to that area or may spread all over the brain. If it spreads to surrounding areas and causes some abnormality of neurological function, we call it a seizure. If it spreads all over the brain, we call it a seizure or major seizure or convulsion. Sometimes this generalized activity may only cause abnormal behavior. Sometimes it may cause convulsion with unconsciousness. Seizures or convulsions may occur only once in life, in which case they are not called epilepsy. Only when such abnormality happens repeatedly, we call it epilepsy. It is a very common neurological disorder. If it stays restricted to one part of brain, it may cause such small abnormalities of hand or face, or it may have abnormal sensations on one part of body, or just for a small period of time an abnormal behavior. In all these cases, we call it a partial seizure. Whereas if the abnormal activity spreads over to whole of the brain, then we call it generalized seizure. So partial seizure or partial convulsion or partial epilepsy is one which is restricted to one part of brain, which may also be seen on the electroencephalogram, whereas a generalized seizure may spread all over the brain, which also is reflected sometimes in the electroencephalogram. Children and adults have different types of seizures. The most common seizure in children is febrile seizure. During high-grade temperature, because of any other cause, children may become unconscious or may have seizures. Such seizures, which are called febrile seizures, do not usually need long-term treatment, but these children have increased risk for seizures or epilepsy in their future life. In adults, when the seizures start after the age of 30 or 40, the usual causes are scars such as those which develop after head injuries or tumors or strokes, or sometimes without any such causes, adult onset epilepsies are known. Adults may also have epilepsies because of certain situations like infections of the brain like meningitis, encephalitis, or in some cases alcohol related, or because of ingestion of certain drugs. Early diagnosis of seizures is very important. Every seizure can potentially cause further damage to the brain, which may potentially cause another seizure. So in our language, we call it seizure begets seizure. So every potential seizure that you can prevent is very important, and that is why we must make all effort to diagnose epilepsy or seizure disorder earliest possible and treat it correctly. Usually a good examination by epileptologist or neurologist, followed by an electroencephalogram or EEG, which records electrical activity of the brain over a period of 45 minutes to 1 hour, and an MRI scan of brain give clues to onset or origin of seizures. Usually people with seizures can lead a normal life if they stick to some precautions. Fever increases the chances of having seizure or epilepsy, so fever of any cause must be immediately treated with antipyretics like paracetamol or ibuprofen or other NSAIDs so as to prevent seizures. Patients with seizures should not fast. They should eat regularly, and they should not have more than 8 or 12 hours of gap between two feeds, because hypoglycemia or low blood sugar is one potent stimulus or precipitating factor for seizures. Again, lack of sleep is another potent stimulating factor for seizures. Every patient must sleep for at least 6 to 8 hours within every 24 hours. Certain drugs may cause seizures, certain drugs may increase your chances of having seizures, and these drugs must be avoided. These lists are widely available on the internet. Pregnant ladies should avoid anti-epileptic treatment except for 1 or 2 safe drugs which are safe in that type of seizure in pregnancy. Even during lactation, certain medicines, anti-epileptic medicines, should be avoided. Your neurologist or epileptologist can guide you properly which drug is most suitable for you. Different types of epilepsies may need different combinations of medicines, and some of these medicines may have long-term side effects, so it is better that you read about the medicines yourself and also discuss with your neurologist the potential long-term side effects of these medicines. Stress is another factor which may cause seizures, so one should avoid stressful life situations, and if one is facing such, he should try or she should try and get out of these as early as possible. Patients with seizure disorder or epilepsy often have depression or some other psychiatric problems. These can be treated very well with medicines and with counseling. If you see a patient having a seizure or convulsion, please do not restrict the patient. See to it that the patient rolls on one side and is in the lateral position with his head on one side. This is to avoid aspiration of anything that is in the patient's mouth, including saliva, into the respiratory tract. Also, see to it that if there are any sharps in the patient's hand, you remove them and prevent head injury when the patient is actually having convulsions. You cannot stop a convulsion once it has started, so patiently wait for the convulsion to be over, and during that period only avoid injuries to the patient. I wish all the very best to all my patients and reassure them that about 70% of the patients of epilepsy or seizure disorder can be treated very well with combinations of new medicines available. They can lead an entirely normal life. They should only avoid swimming, driving, flying, or adventure sports. Otherwise, they should be able to live a normal, happy, productive life. Best of luck. Thank you.